Assalamu alaikum guys, welcome back to my YouTube channel. So the topic of discussion for today is trichiasis. Now trichiasis is the misalignment of the in the direction of the eyelashes. So normally they are pointed outwards and upwards in a curved pattern, and the ones below are pointed downwards and pointed up forward and downwards in a curved pattern as well. So if there is a misalignment in their direction, let's say they're pointed inwards towards the eyeball, or in some other pattern sideways, you can say. So this is defined as trichiasis. Now before going further into this, let's discuss a few other terms that are usually confused with trichiasis. One is entropion. Now is entropion, the eyelid as a whole is turned inwards. The eyelashes are fine, but if the eyelid itself is turned inwards, then the eyelashes will automatically touch the cornea, the eyeball. So the presentation of both are the same, but you need to differentiate between the cause of both of them, because the treatment depends on the cause. Another term is pseudotrichiasis. Pseudotrichiasis is the same thing as entropion. In pseudotrichiasis, we say that it is secondary to entropion. So both are the same thing, but this is another term you need to keep in mind if it comes in exams. Now the next term is dystrichiasis. Now in this one, there's an additional row of eyelashes apart from the normal row, and that are directed inwards to your eyeball, to the cornea, resulting in the same symptoms of photophobia, lacrimation, redness, and so on. So let's come to the topic of today, that is trichiasis. Now the causes of trichiasis is that usually they result from any injury or any scarring or inflammation of your eyelid. So if you keep that in mind, you can think of various causes. The first cause can be blepharitis. Now blepharitis is the inflammation of the eyelid. So if that inflammation is prolonged due to any reason, this will result in it can lead to the inward deviation of the eyelashes, since it's the inflammation of the eyelid. Second cause, trachoma. Trachoma is the infection of the eye by the bacteria Chlamydia trachomatis. Now then comes chemical burns, and you can think of any other traumatic injury to the eyelid. So the result is inflammation and scarring due to any reason can result in this disease. Now clinical features. Let's imagine if there's a foreign body sensation in your eyes. In usual days, you're walking outside, a foreign body gets lodged into your eyes. How do you feel? So the main three symptoms are: the person feels redness, there's watering of eyes, there's photophobia, and there's consistently foreign body sensation. That's obvious. So these are the same symptoms you will feel in this disease. And in extreme cases also, corneal ulceration and secondary bacterial infection can occur if not treated in time. So having discussed the causes, let's come to the treatment now. Now there's multiple treatments for this. We're going to discuss the ones that were used before and the ones that are recently used. So let's discuss epilation first. The first one, epilation. In epilation, the hair follicle with the bulb is removed. Now in this one, obviously, if you remove the bulb, there will be no hair follicle again. So you're getting a complete treatment for this. But like I said, this isn't used much. There are other modern procedures comparatively. Second one is electrolysis. Now in electrolysis, a current is passed with the help of a probe or instrument to the eyelash follicle, and as a result, that hair follicle is destroyed, but with the help of current hair. So electrolysis is the second one. Then comes cryotherapy. Now cryotherapy is a modern technique. It is very efficient, very advanced. In this one, what we do is that we freeze the follicle. The hair follicles are frozen with the help of a probe, and then they are destroyed. And this is effective in removing a large number of hair follicles usually. So if you have a hair follicle at a place in the eyelid that you need to be removed all of them, so you can go for this procedure and they can remove all of them, be removed. One thing I would like to add is that in this one, the temperature is usually -200 in cryotherapy to remove the hair follicles, to freeze them and then remove them. Okay, so the next one is argon laser. Now argon laser is obviously it's a laser that is used to remove hair follicles again. And another thing I would like to add is that you can have contact lenses in your eyes until you have undergone the treatment, because contact lenses will temporarily protect your cornea from these eyelashes and from any disease. So it's a good method you can use this. It is completely harmless, and temporarily it will protect your cornea and your eyes. One other treatment that is in mind is that there's anterior lamella and posterior lamella in your eyelids. The anterior lamella is comprised of the skin and the orbicularis oculi muscle, and the posterior lamella is comprised of the tarsus, the tarsal plate, and the conjunctiva. So if you somehow there's anterior displacement of the posterior lamella, you somehow displace it anteriorly, this will result in the eyelashes being away from the eyeball and the cornea. So this is another helpful very good technique to cure this disease, I would say. So after discussing the treatment of this disease, let's come to the complications. The complications that comes into mind that can happen is keratitis or conjunctivitis, corneal opacity, or corneal ulceration result, and also superimposed bacterial infection can occur. So this was all about the topic of trichiasis. I hope you've gotten some brief idea, and if there are any questions that I haven't answered or that is in your mind, please do comment. I do read my comments and I will try to answer them in the next video. Until my next video guys, take care.